Assalamu alaikum. I am Dr. Muhammad Salim, consultant pulmonologist. As we were discussing April 2015 FCPS Pulmonology paper, so we will jump towards the question number 3, which is shown on your screen now. A 31 years of aged female smoker presents in pulmonary clinic with progressive dyspnea and chest pain. The chest X-ray reveals left-sided pleural effusion. HRCT chest shows diffuse air containing spaces. Ultrasound abdomen shows hypoechoic lesion in the left kidney. What investigations you will ask for pleural effusion and what do you expect? This was the part A. The part B is what is the diagnosis? Write favoring points. The part C is what are the recommendations and drug options available. So, what do you think in a young female patient, a smoker with left-sided effusion, and there is hypoechoic lesion in the left kidney? If it would be a mass in the gonads or the ovaries with this left-sided pleural effusion, we could have thought of Meek syndrome, but there they have asked you in a young female with left-sided pleural effusion and hypoechoic lesion in the left kidney. So we will first solve part B. What is the diagnosis? The diagnosis would be lymphangioliomyomatosis, which is in short form called LAM. In LAM, there are usually two scenarios which CPSP asks. One in which there is obstructive spirometry and the patient is obviously female with obstructive defect in the spirometry, and number 2, this is the scenario in which CPSP asks about the female patient with effusion, pleural effusion and a mass in the kidney. So our diagnosis is lymphangioliomyomatosis. Write favoring points. The favoring points are young female, unilateral pleural effusion, HRCT shows cystic lesions, and ultrasound kidney shows angiomyolipoma. Okay. So the part A will be solved as appearance of the pleural fluid, which will be obviously milky, and pleural fluid triglyceride would be greater than 110 milligram per deciliter, or presence of chylomicrons. So this is the definition of the pleural fluid of the patient with LAM. This is chylothorax, presence of chylomicrons, and pleural fluid triglycerides would be greater than 110 milligram per deciliter, and the patient would have pleural fluid exudative and many other things, the cytology, the differential cell counts, but specifically they are asking for the investigations you have to ask in a patient with pleural effusion and a suspected diagnosis of LAM. This is A and B. The part C will be solved as genetic counseling for tuberous sclerosis. These patients with LAM have clinical features of tuberous sclerosis, which is a neurological disease. We will discuss it later on. Right now we are solving the part C as recommendations and drug options available for this diagnosis. For this patient, sirolimus, progesterone only pills, because we have to avoid estrogen in these types of patients. Explain concerns regarding air traveling, because these patients, as I told you before, that patients have obstructive lung disease, they have ruptured cystic spaces which can lead to pneumothorax. so they are very prone to pneumothorax. So we have to counsel them regarding the air traveling measures, advise vaccination, refer to smoking clinic. Because the patient is a smoker, you have to target her to quit smoking, refer her to smoking cessation clinic, advise diet free of triglycerides and pulmonary rehabilitation. So this was question number 3 of April 2015 paper. And comment me in the comment box that what did you not understand regarding this question. Thank you so much. For more solved cases, get this book in nominal price from local medical bookshop or online nationally and internationally from links below.